Hi, so I wanted to answer the question today of will physical therapy help a pinched nerve? And the short answer, yes. Let me give you a little bit of a longer answer. So yes, physical therapy can help a pinched nerve. Can it help 100% of people with a pinched nerve 100% of the time? No, it can't, but it can help a lot of people a lot of the time. So in physical therapy at our office here, we definitely treat a lot of nerve issues, people with pinched nerves, irritated nerves, and so you might say, okay, well, how does that happen? Now, a lot of times I don't even like to use the term pinched nerve. I like irritated nerve better. It can have a lot of negative connotation to it, saying pinched nerve. But what it is when that nerve gets irritated, and there's a sheath that surrounds the nerve, and it should be able to glide back and forth. The nerve should be able to glide back and forth within that sheath. And when it doesn't glide back and forth and get bound up a little bit, but if physical therapy can reduce the strain on the nerve, we do that usually through, at least at this office, through hands-on manual work and some goofy exercises to help restore movement, maybe work on motor control, muscle timing, strength endurance, things like that. You can reduce the inflammation, that irritation that's on the nerve, get that nerve gliding better again, and do really well in a lot of cases. So I hope that answers the question. If you do have any more questions, feel free to give me a call, 305-433-1172. I'd love to chat with you about it, and talk to you soon. Okay, take care. Bye-bye.